The Six Nations Development Corporation officially opened its doors on May 1st, 2015. The boards of the Development Corporation will have the responsibility for overseeing the funding that we will be generating from the various projects we have entered into. They will be responsible for all of our own source revenue. They are planning on holding a community meeting in the very near future to introduce the board members to the community and to let you know what the Development Corporation will be doing. So please watch for notifications of that community meeting and plan to attend. In past updates, I had informed you of a public campaign and a committee that was working to prevent drug and alcohol abuse along with bullying and suicide in our community. This committee is now being called the Community Collaboration Committee. They are ordering 3 signs to get our message out there, and they will be installed by mid-June. Initial locations for these signs are the Iroquois Lacrosse Arena, the Gaylord Palace Arena, and the Six Nations Council office. They can be moved around to other locations later on. We're also ordering pen banners, which will include the telephone numbers of the different agencies that provide services to the community. The logo on the pens will be I Matter, You Matter, Six Nations Matters. The committee is also looking at placing holders on the back of washroom doors in our public buildings. So please join in this campaign and let's all work together to make our community a safe and healthy place for us all to live in. I have some updates on health, and the first one is that I just want to remind you that everyone should get vaccinated against tetanus. Tetanus is a painful and life-threatening condition which is also known as lockjaw, and it can be contracted when a vulnerable person is exposed to the bacterium Clostridium tetani spores. These spores are found in soil, dust, and manure, and infection occurs when they make their way into a cut or a wound. The name lockjaw comes from the severe muscle contractions that are triggered by the toxin, and infection occurs when they make their way, as I said, into a cut or a wound. The name lockjaw comes from the severe muscle contractions that are triggered by the toxin the bacteria produce. The spasms are so strong, in fact, that people can suffer broken bones. They can also interfere with breathing. Tetanus infections are fatal in a significant portion of cases, with the rate varying among different age groups. There is no specific remedy for tetanus, although people who contract the infection may be given an antitoxin and are often treated with sedatives to control the spasms. Although commoner in the past, tetanus is now rare because most people are vaccinated against it. Children are supposed to get 4 doses of vaccines containing tetanus protection, and adults need tetanus booster shots every 10 years. So we do encourage everyone to get those vaccinations. I also wanted to give you some information on the Aboriginal Patient Navigator program and the role of the patient navigator. There are patient navigators in the 3 regions of Hamilton, Niagara, and Haldimand-Brant, and their role is to provide navigation services that are culturally appropriate within the healthcare and the social services systems for individuals, caregivers, and their families, and to help improve patient outcomes. They also provide support to mainstream service providers such as healthcare provider appointment specialists, the hospitals, hospices, community care access centers, and social services. The patient navigator for the Haldimand-Brant area is Tara Miller, and she can be reached at Brant Native Housing at 519-750-4323. So if you need any help with the hospitals or any of the healthcare access centers in Brantford or Hamilton or Niagara, please give Tara a call. I also want to profile this on this update, the Six Nations Family Health Team. It's located at the White Pines Wellness Center, and it provides primary care to community members whom are registered to the team. You have to be registered to the team to access their services. It is a multidisciplinary team approach to health care, which includes health assessment, illness prevention and health promotion, disease management and disease prevention, patient education and support, diagnosis and treatment of acute and chronic illness or injury, primary reproductive care, palliative care, coordination of services, primary mental health care, and referrals to specialists for care and access to prenatal and obstetrical care. They also have specialized clinics, which include pediatrics, nephrology, endocrinology, and foot assessment for orthotics. There's also a traditional healing program, which is part of the clinic for those patients that choose this option. As well, there are evening clinics for patients of the team.